One of the things that you mentioned, and I want to help have you dive in a little bit further, is you talked about depression as an inflammatory disorder.
Yes.
So can you describe what you mean by that a little bit more deeply, and maybe talk about how we understand systemic chronic inflammation?
Yes.
How does that show up in the brain?
Right, right. So this is, I remember the first time I saw a diagram of how it shows up in the brain, and it was, it's a relatively recent discovery, but I remember just feeling so turned on by it, like, this is it. This is, if we want to generalize about this very, sort of multifocal and sort of, this very vague syndrome, we should at least do it in this way. So, like I mentioned, important leaders in psychiatry at the NIMH, those folks who head up the DSM, board that determines the criteria, are acknowledging that the era of the monoamine hypothesis, and by that what I mean is that serotonin, dopamine, norepinephrine play a critical role in mental illness at large. That the era of the monoamine hypothesis is coming to a close, that we've experienced severe limitations in our ability to extrapolate from that into effective treatments, and that we need to start thinking more broadly. And so to think about, it was in the early 90s that this idea of the cytokine theory of depression was first put forth. And to think about an alternative is really appealing. And so this is the most appealing alternative to me. It's the one that I think I'm able to leverage clinically the most effectively, and it's the one that makes the most sense in the context, in the greater landscape, as I mentioned, of other chronic illness.